Welcome to the MS&Me Radio Network, a division of the Multiple Sclerosis Global Support Network. The following program broadcast is an original creation by the broadcast entity. Discussion within the following broadcast should be used for informational purposes only and is not a substitute for professional medical advice or consultation. Before considering application of any broadcast content in the following program, please consult your healthcare provider. If you feel you are having a medical emergency, please contact your local health services for immediate assistance. MS&Me Media and the Multiple Sclerosis Global Support Network do not guarantee or warrant the accuracy of information in the broadcast to follow. The Multiple Sclerosis Global Support Network provisions broadcast services to program hosts. Information discussed in the broadcast does not necessarily reflect the views, opinions, or goals of the network and are solely those of the show broadcast host. Should you wish to host a broadcast, please visit our website at msmemedia.com and submit a request to become a program host. We thank you for listening to the MS&Me Radio Network. Enjoy the show. Welcome to Ask MS&Me. I'm your host, Erica Richardson, and my co-host is traveling today and couldn't be with us. This show is all about your questions being answered from the point of view of fellow patients living with multiple sclerosis. You can submit your questions each week by using hashtag AskMSandMe. Do that on your social media accounts or contact us through our website www.msandmemedia.com. That's msmemedia.com. Let's get started. Let's see if we have a question coming over. Yes, one from our singles group on Facebook. It says, I heard we couldn't use hot tubs or saunas. True or no? Me personally, I cannot use a hot tub. It throws me into a pseudo flare with MS, like the hug being the most painful symptom. For many years, the hot bath test was used to diagnose multiple sclerosis. A person suspected of having MS was immersed in a hot tub of water, and the appearance of or worsening neurologic symptoms was taken as evidence that the person had MS. Many people with MS experience a temporary worsening of their symptoms when the weather is very hot or humid, or when they run a fever. These temporary changes can result from even a slight elevation in core body temperature, 1/4 to 1/2 of a degree. An elevated temperature further impairs the ability of demyelinating nerve to conduct electrical impulses. Activities including sunbathing, exercise, taking very hot showers or baths can have the same exact effect. For example, some people notice their vision becomes blurred when they get overheated, a phenomenon known as a Uthoff sign. Heat-related symptoms are temporary. Heat generally produces only temporary worsening of symptoms, but it does not cause more disease activity, demyelination, or damage to the nerves themselves. The symptoms generally reverse quickly when the source of increased temperature is removed. Strategies for easing the effects of the heat. You can stay in an air-conditioned environment during periods of extreme heat, humidity. If an air conditioner is needed to help minimize the symptoms, the cost of this equipment may be tax deductible if the physician has written a prescription for it. Using cooling products such as vests, neck wraps, a bandana during exercise or outdoor activity. Wearing like lightweight material, loose breathable clothing, icy drinks, or popsicles can also provide temporary relief. Using an oscillating fan or air conditioning during indoor exercise. Exercise in a cool pool, less than 85 degrees, or a cool environment. If you are exercising outside, pick cooler times of the day, usually like early morning or evening, and try pre or post cooling to decrease the heat effects of the exercise. Get into a bathtub of cool water and continue adding cooler water over a period of like 20 to 30 minutes. A cool bath or shower can also help reduce your core body temperature, like following your activities or exposure to the hot environment. But please contact the MS Society or the MSAA or other MS Foundation, or the for our international listeners, the MS foundations in your local region for more information on ways that you can combat this. A cold, it can also be a problem for some people with MS. They notice their symptoms, particularly spasticity, become worse in cold weather. It's generally recommended that people with MS who are sensitive to temperature try to avoid extremes, one or the other, hot or cold. Anyone considering moving to a better climate per se, we hear that question a lot. They should first visit to see if that climate change is indeed beneficial for their individual symptoms. Some patients living with MS are just as, or let's say more, so intolerant to the cold than they are to the heat. So definitely check out the region before you make that kind of a move. All right, let's see what our next question is coming over. This one is from Progressive Group, SPMS and PPMS group on Facebook. It says, how do y'all eat if you have bad hand tremors? Okay, I've had this problem, so I can understand this question. My suggestion is to minimize your tremors. Start by eliminating contributing factors that can be controlled, like your fatigue, stress, too much coffee. There are no great treatments for MS tremors once they start, which is why prevention is important. Early aggressive treatment with available disease-modifying drugs can also help prevent tremors from ever becoming a problem. For those of you who have developed the tremors already, treatments can be occupational or physical therapy to help you manage those tremors that interfere with your daily life. These therapies could include the use of braces, weighted devices, the wrist rests, exercises to increase your control and balance. I use the weighted wrist weights. That helps me. Medications, which can include anti-anxiety drugs, antihistamines, beta blockers, anti-nausea medications, anti-seizure meds have also been used to treat the tremors caused by MS. Now, no drug has been specifically approved in the MS in the U.S. for MS tremors, but none of the available MS drugs treat tremors either. But, you know, there's a new therapy. It's often used to treat Parkinson's disease. It's called deep brain stimulation, and that may also be helpful for those really extreme cases of MS tremors. It involves implanting electrodes into the brain to block the involuntary muscle movements. Now, that deep brain stimulation does show promise, but the improvements are not always dramatic enough to justify the risk of the brain surgery. The complications like infection and bleeding in the brain. Botox, that's another one that's used to temporarily smooth frown lines, you know, among other things. But it also can treat MS-related limb tremors. So there have been studies on that. When injected into the muscle, the Botox blocks the nerve signals that causes those involuntary movements. So that effect, I guess it lasts between like 2 to 6 months. So that's another treatment as well. Let's see if we have another one coming across social media here. We have one from our ladies group on Facebook, ladies only. It says, does anyone have issues swallowing when you're eating? This is a new symptom for me and it's been going on for the past few weeks. This is another one of my personal symptoms, so I can speak to that. People with multiple sclerosis often have trouble swallowing. It's a problem called dysphagia. It can also lead to speech problems, which it did with me. It happens when the disease damages the nerves in the brain and the spinal cord that make these tasks happen. I also had trouble making enough breath sounds to make a voice as well with this. For some people, these problems are mild. Others have a harder time depending on, what kind of severe symptoms they're having. But treatments and techniques can help you improve your speech, which it has for me, and make swallowing easier. Cough or choking when you eat, feeling like your food's lodged in your throat. You get a lot of lung infections like pneumonia that you can't explain. And when you can't swallow properly, you might inhale your food or liquids into your windpipe instead of getting them down your esophagus and into your stomach. So once in the lungs, they can cause pneumonia, abscesses, so it's very, very dangerous. You could also be at risk for malnutrition, which I have chronic malnutrition, or dehydration because of your food and water aren't getting into your stomach. So this can actually be a very severe issue. So getting diagnosed. So how would you know if you have dysphagia? Your doctor, he will ask you symptoms, do the physical exam, rule out other issues, paying attention to how well your tongue and other muscles in your throat are moving. Sometimes they might recommend you get a test called a modified barium swallow. You drink this drink, a special liquid that coats your mouth and throat and esophagus. Then your doctor gives you an x-ray. And the fluid makes your insides stand out in the image. And then the test helps your doctor pinpoint where and why you're having any trouble when you swallow. They also might suggest that you see a speech therapist or a speech language pathologist, which I saw. They can figure out which part of your speech is being affected and study your breathing control, your breath control, the way you move your lips, your tongue, your parts of your mouth, and it did wonders for me. I also had to adjust my diet, start using food thickeners with certain liquids, and that sounds counterintuitive to make certain things you're eating thicker, but it actually does work and help it go down correctly. But speech was just a blessing for me personally. So I can say that I highly recommend that if you're having this issue. Okay, let's see if we have another question coming over. Yes, we have one through Twitter. This come over on hashtag #AskMS&Me. I have had MS for 24 years. So I've been fighting this monster for a while. When did these MS specialists, that's in quote, come onto the scene? Okay, I can answer that. Other questions about how your immune cells affect the brain and how your brain influences your immune function are not new. Neuroimmunology as a field of research is relatively young, okay? The term has only been in use since the 1960s. It was just like 30 years ago that neuroimmunology as a branch was established at the National Institutes of Health, the federal agency here in the U.S., responsible for advancing biomedical research. Today, the study of the nervous system, immune system, the interactions, it's thriving, and more scientists from diverse areas of medical research are drawn into the field. However, around the world, neuroimmunologists are kind of in short supply. You will find that, especially if you aren't in a very, very highly populated area, that it can be hard finding an MS specialist, a neuroimmunologist. And depending on what kind of insurance coverage you have, it can be difficult finding someone in network. I know mine here in this area, and I live near a large city center. They are not covered under my insurance, and I had to get an insurance override to build a network to even see my MS specialist. So that's not uncommon. But you can call the MS Society or your health carrier if you're seeking an MS specialist in your area. Now, does that mean that a regular neurologist cannot treat you with MS? No, it does not mean that. I've seen many great neurologists who, although they did not specialize in MS, I did receive very good treatment from. So that does not mean that you won't get good treatment if you don't have a neuroimmunologist in your area. Okay, looking online to see if we have another one coming in, another question. This one's actually from the ladies group on Facebook. It says, how do you ladies keep from getting so tired doing your hair and makeup? That's a good one. Okay. Well, that's kind of difficult because it kind of depends on your particular situation. I know for me, it's all about timing. Medications, rest periods, and that can be difficult, especially if you have an event to go to and you don't have a choice about when and what time of day. If I do get a shower before having to do my hair and makeup, if that's like really close in time proximity, I make sure that I do have time to cool down after the shower, because you're going to have to, if you're heat intolerant like me, you're going to need that time to actually bring your core temp down and get your energy back. I do allow time for breaks during the process, and it can be quite long. It's gotten longer and longer over the years. I use a chair, of course. You can use a chair if you have to, even if you're always used to standing in front of the bathroom mirror, wherever. You may want to use a chair even if you don't feel like you're getting quite so tired. So that might be a good tip for you. It just saves a little bit of extra energy. When you're like lifting your arms to brush your hair, or say curl your hair, straighten your hair, blow dry, I'd suggest being near a wall where you can actually lean your arm that's lifted so far up in the air up against it and brace it. That saves me a lot of shaking or fatigue when I have my arm lifted. Well, I can't actually do that anymore, but back when I could do that, it saved me that. Let's see, another tip. Tremors. If you have tremors and you're trying to do your own, like say, makeup, you can wear wrist weights. That's a way that I always did it to steady my hands and get the makeup on. But simple is better. I mean, low maintenance, especially if you're having tremors or if you're having fatigue issues or eyesight issues. Simpler is better. Just sometimes you can't just get so complicated with your hair or with your makeup. If you really don't mind having short hair. So short hair is sometimes easier to take care of. For some women, though, it's easier to have hair long enough to pull up, to just be able to pull it up all the time, whether in an updo or just a simple ponytail. I find it difficult, though, if you're on your own, to get it in a ponytail, so that's not always a great idea. That's why you see so many of us cut our hair short. Okay, let's see if we have another question coming over. This one is coming in from our info hub. So this is our main group on Facebook. It's called the MS&Me Info Hub. This one says, Charlie horses are like tightening and stiffness in my legs. How common is that with MS? I also get these horrible ones in my feet, and now they're starting in my hands, along with this jerking and that tightness. Today I was driving and my arms just jerked and scared me to death. Okay, so it sounds like what you're describing is spasticity, which refers to the feelings of stiffness. It covers a wide range of involuntary muscle spasms, sustained muscle contractions, or sudden movements. It's one of the more common symptoms, actually, with MS. Spasticity may be as mild as feeling a tightness of your muscles. It could be so severe as to produce those painful, uncontrollable spasms in your extremities, usually the legs. Spasticity can produce those feelings of the pain or the tightness in around your joints. It can cause that low back pain that many of us are so familiar with. Although the spasticity can occur in any limb. It's much more common in your legs. It varies so much from person to person. It can be treated on an individual basis, and it really demands a true partnership between the person with MS, their physician, their nurse, their physical therapist, occupational therapist. So it takes a village. So treatment, it begins with your physician recommending ways to relieve your symptoms, including exercises, medication, changes in your daily activities, or combinations of all those. The physician tracks your progress. They make referrals to the other health professionals mentioned, such as your OT, PT, your daily stretching, other exercises are often effective in helping to relieve spasticity. Two major anti-spasticity medications that have good safety records are, of course, the baclofen and the Xanaflex. So they're the most popular. There's many more, though. Neither can cure the spasticity or improve your muscle coordination or strength. However, they can relieve slightly those symptoms. But it's better to do it in combination with all those other things that your physician or clinicians recommend. Okay, let's see if we have another one coming in off of social media. Oh, this is another one from Facebook. This one is from our progressive group again. It's from that progressive and SPMS and the PPMS group. It says, "Hi, have any of you ladies or gentlemen experienced loss of taste with your MS?" Okay, yes, I have. I've definitely experienced this. Patients with multiple sclerosis can lose the ability to distinguish all four classic taste qualities. That's the sweet, sour, bitter, salty. A signal associated with MS-related lesions in their brain is usually the culprit. A recent study found that participants with MS had more problem identifying taste when compared to a control group of participants. Of the participants with MS, 15% had difficulty identifying the bitter taste, 22% the sour taste, 25% the sweet taste, and 32% the salty taste. So those participants who had more trouble identifying the taste also had a larger volume of lesions as seen on their MRI scans. So definitely there are studies out there that you can read who will explain this for you. The participants with the MS rated the intensity of the bitter taste lower than control groups, but they were still able to rate the intensity of other tastes appropriately. So that does suggest that MS has a stronger effect on the ability to taste and identify what is, and rather than how strong of a taste. So you'll have trouble tasting like what it is more than just how strong of an intense flavor. Okay, so overall, both in MS, and control groups, women do better at identifying taste. That's kind of been a long held thing that people always say, that women are better than men at identifying those with their taste buds. So why is taste even important? Why do we, really need to pay attention if we're having trouble with taste? If you cannot taste your food properly, you could potentially eat something unsafe. You may not enjoy your food if it doesn't taste right. This could potentially mean people could cut out certain foods out of their diet, which could lead to malnutrition, which is a common condition with MSers, and you might not get the right balance of nutrients for your health. So it really can have actual severe health consequences. It's not just an enjoyment factor. So this can be a serious issue and does need to be discussed with your doctor. Okay, let's see if anything else is coming in. All right, looks like we have one. This one is again from Facebook, the MS Lupus and Me group. It says, "I have a really sore, painful scalp at the crown. It feels like it's burning and is painful to the touch and when I move my hair. kind of similar to the feeling you get after your hair is in a tight ponytail for a long time. Does anyone get this or know what it could be or know if it's related to MS? Okay, so yes, trichodynia, it refers to pain, discomfort, or even paresthesia in the skin of the scalp or in your hair. Sensitive skin it's also referred to as reactive or hyperreactive, intolerant, and irritable skin. It's defined as the onset of prickling, burning, tingling sensations with or without pain, or pruritus, which a lot of us are familiar with MS. It's triggered by various factors, which may be physical, ultraviolet radiation, heat, cold, wind, chemical exposure like cosmetics, a new soap, water pollution, a psychogenic, which is stress, your hormonal with your menstrual cycle. But neurogenic inflammation probably results from the release of neurotransmitters in your brain, such as substance P, the calcitonin, gene-related peptide, and it's an intestinal peptide as well, which it induces that mast cell degranulation. So it's a process. Substance P levels can be checked, actually, and are often the source for the scalp sensation issues for patients with fibromyalgia, lupus, MS, Sjogren's, other autoimmune disorders. So definitely speak to your doctor about that. You might even need to go to a specialist. You might even need to see a referral if they suspect other disorders besides multiple sclerosis as the root cause. All right, let's see if we have another one coming over. This one is coming in from Twitter. It's from hashtag Ask MS&Me. It says, anybody tried amitriptyline? I think they just misspelled that. It causes burning in your feet. Yeah, they meant amitriptyline, HCl. Common brand name, if you're not familiar, is Elavil. So you might be familiar with the brand name. This medication is used to treat mental mood problems, depression. It may be used to help your mood, feelings of well-being, relieve anxiety, tension. It can help you sleep better and increases your energy level in many patients. It belongs to a class of medications called tricyclic. I'll try that again. Tricyclic antidepressants. It works by affecting the balance of certain natural chemicals, neurotransmitters like serotonin in your brain. Although it's not approved for these uses, it can also be used for fibromyalgia and nerve pain. So that's two biggies in MSers that it's often prescribed for off-label. To reduce your risk of side effects such as drowsiness, dry mouth, dizziness, your doctor may direct you to start these medications at low dose and then they gradually increase your dose. So follow your doctor's instructions carefully when you're on these medications. Tell your doctor right away if you have any really serious rare side effects like easily bruising, bleeding, persistent heartburn, shaking, mask-like facial expressions, muscle spasms, the abdominal cramping, decreased sexual ability, desire, or enlarged painful breasts. So there can be some serious side effects, but those are very rare. Get medical help right away, though, if you have any of the side effects like black stools, vomiting that looks like coffee grounds, severe dizziness, fainting, seizures, eye pain, swelling, redness, widened pupils, vision changes such as seeing like rainbows around lights at night. But this medication may rarely cause very serious condition called NMS. Get medical help right away if you have any of these following symptoms: fever, muscle symptoms, severe confusion, sweating, and fast irregular heartbeat, which can be hard because that's also similar to our MS symptoms. But when in doubt, definitely call your doctor. So a very serious allergic reaction to this drug is rare, but in the question they said it can cause burning feet. But they may have meant it actually is used to treat burning feet. But either way, if it's being used for burning feet, yes, it is used off-label for that. If you mean that it's causing your feet to burn more, then that is something you need to ask your doctor about, okay? Because that could be a side effect. Now, a very serious allergic reaction, like I said, is rare, but if you notice anything like a rash, like that extreme burning, itching, swelling, especially if it does happen to like around your face, your tongue, your throat, then that's when it's very serious. Trouble breathing, then that's a trip to the ER. So take this medication regularly. That's how you get the most benefit from it. Just make sure you follow your doctor's instructions. It's important to continue taking it even if you don't feel well. Do not just stop taking it because you got some symptom, especially if it's not a very serious symptom, until you consult with your doctor. Some conditions may become worse when it suddenly stopped. Okay, so you really need to make sure that you are following the doctor's instructions really closely, especially if this is a side effect that you're having from the medication. And this is the type of medication that doesn't just always start working right away. You might see benefit within a week. However, it could take like up to 4 weeks, like a month, before you see full benefit from this medication. So tell your doctor if your condition persists or worsens, such as if you're taking it for depression, your feelings of sadness get worse, or you have, of course, thoughts of suicide. You want to keep your doctor in the loop at all times. Okay, let's see if we have another question coming in. We have another one off of Twitter. This is hashtag Ask MS&Me. Does anyone notice a change after drinking coffee or tea? Okay, so according to a number of recent studies, coffee and tea could keep your brain healthy and provide protection from multiple sclerosis, Alzheimer's disease, Parkinson's disease, and depression. So you can actually get benefit according to the new studies. Drinking 4 to 6 cups a day, which is a lot, is associated with a lower risk of MS, as is drinking a high amount of coffee over 5 to 10 years. According to researchers, caffeine has neuroprotective properties and seems to suppress the production of pro-inflammatories. So, and you can slightly lower your risk of depression by drinking coffee, according to another study they did with the NIH, with the National Institutes of Health here in the U.S. So there are ongoing studies that are showing benefit. Scientific American reported that some studies suggest that coffee and tea drinkers have lower rates of cognitive decline too, but of course that evidence mixed. That wasn't very specifically reported. That being said, caffeinated beverages are valuable stimulants in everyday life, but they will aggravate like urinary incontinence and urgency, and can aggravate hand tremors in some patients with pre-existing symptoms. And you can have problems with dehydration. So it can cause issues with that as well. So that will cause, more of your muscle cramps. So although there are benefits to some of these things, there can also be deficits as well. But just talk to your doctor about that, especially if you have questions about your personal caffeine intake. But that's with any of these questions that come over on social media. We need to be talking to our physicians. We can get great sources of information online now through support networks. We can get great, support networks and forums, all kinds of wealth of information that come out of reading great online news sources like our own at MS&Me. But we really need to keep a close relationship with our own physicians. They know us the best because we are getting answers and information specific to one condition when we read these sources. And we're human beings, so we have sometimes many sources of disease or processes in our bodies. We may have comorbidities like diabetes going on or asthma, on multiple medications. And you might say, oh, well, this condition doesn't cause this. Well, it could be a side effect of your medication, and it could be related to your treatment of that condition. So yes, it can be related in a roundabout way. So it's hard to answer questions in black and white. That's why we always refer you over to your physicians and clinicians for the final answer. So we can give you our patient point of view, our personal experiences, but we want you to follow up with your personal physicians. Let them be the final guide, especially when they know about possible drug interactions in your case or other conditions that could be maybe an underlying cause or skewing your symptoms a little bit or possible side effects. So we definitely want you to give your physician a call and confirm the information that you are getting from us and see how that applies to you in your particular case. Okay, let's see. We have another question coming in from Twitter. This was to hashtag Ask MS&Me. And it says, what are all of these new hashtag Racing MS posts I'm seeing? What is the Auto Racing MS and the MS Awareness series? Okay. I can explain this. This is actually something new that MS&Me Media Racing has gotten involved in, and so has our parent company, the MS Global Support Network. So what the MS Awareness Series is, it is an amazing effort to raise multiple sclerosis awareness through a field of talented simulation racing drivers online. They've banded together to change the world of MS. From the satellite map tracks to the race car physics, the drivers, they put forth an exciting event in conjunction with Max Speed TV online for an ultra realistic driving experience on the weekly telecast. I mean, this looks just like you're watching NASCAR on television. It is just such an exciting race with the announcers and the drivers, and it's just so much fun. But the series was originally created, the MS Awareness series was originally created in early 2017 by Bobby Cheney. His father lived with MS as well as his aunt. And Bobby in his life has witnessed the impacts of multiple sclerosis, and he set forth to make a real difference. So we commend Mr. Cheney and all the SRA MS Awareness Series drivers for creating a unique mechanism for us to raise MS awareness. And, we're really honored to even be part of it here at MS&Me. But the Multiple Sclerosis Global Support Network, the MSGSN, and our MS&Me Media Division, the whole staff, we band together and we urge you, whether you live with MS, you don't live with MS, you're part of an organization out there, a patient organization, any organization that serves the MS community, to join us in this and support the effort. It's so much fun seeing the cars. There's an MS&Me media car with the paint scheme, and it looks really cool with the bright colors. There's an MSGSN car. The MS&Me driver, Marcus Richardson, I just love him to death. He is really into supporting those of us living with multiple sclerosis. He's one of the top drivers, well, the top driver in the league right now, then in the series. And then the MSGSN car, which is so cool, the graphics on it. The driver there, Femi Olat, he is also winning races this year. I mean, he's just amazing, coming third last week, and Marcus Richardson won that race, and it's just so much fun. pitting the cars against each other and going, who's going to win it this week? And I just hope all the other organizations jump in and support their own car, sponsor their own car, and we just have so much fun supporting these different drivers who really are learning and caring and spreading awareness. And I just think it's a great way to raise MS awareness outside of our MS community, because so many people are into the iRacing online. So it will spread beyond the MS community, what Bobby has created. And I think all of us can band together as a whole community to support this. And you can donate directly to the drivers if you want. There's a button even on our website to donate to National MS Society. You could just get behind these cars and cheer them on just for awareness. And it's just a really, really great way this year to show your MS awareness spirit. If you want to find out more about this, you can go to the website autoracingms.com. That's autoracingms.com. And to really get this trending and get this awareness out there, you can use the hashtag on your social media, hashtag RacingMS. That's hashtag RacingMS. And I think we really need to get this out there and trending on social media because it's just a really fun way for all of us to not only support MS, but to take a little mental break and have some fun with this. So it's really great. But you can donate to the charity sponsoring your favorite driver. You can support the driver, like I said. So we just hope that you can just continue to support the MS Awareness Series and draw more great drivers in, more attention in. There's so many celebrities in the NASCAR series and other series who themselves compete in iRacing, and they enjoy it. They even use it as training. So it's a wonderful, wonderful medium. So I hope you guys all join in on that and enjoy it as well, because I have a lot of fun with it. So I hope you do too. All right, let's see if we have another question. Okay, this is another one coming in off of social media. This came into hashtag AskMS&Me. So what is this Ekrem stuff we're seeing everywhere? So Ekrems, okay. Ekrems, if you don't know, it's spelled ECTRIMS. That's actually an acronym. It, it stands for the European Committee for Treatment and Research in Multiple Sclerosis. It's a nonprofit organization, an independent representative European-wide organization. It's devoted to multiple sclerosis. So those in the U.S. might have heard of ACTRIMS, and this is ECTRIMS, so the European organization. So basically, ECTRIMS works with researchers and clinicians of its member countries and with other organizations that share their similar missions and objectives on a worldwide scale. They create networking and collaboration opportunities. Their ultimate goal is to improve basic and clinical research and clinical outcomes in multiple sclerosis. So they support and promote basic clinical research. They liaison with other related organizations on a worldwide scale. They support education and teaching opportunities for the professionals that enhance their ability to deliver better quality clinical care. They act as representatives of the MS research community and the member countries. They get actively involved in coordinating initiatives in research and clinical care, both in Europe and worldwide. And they have the annual congresses. They organize workshops related to teaching activities in the field of MS. So they're big on education and research. They support European activities relevant to MS, and they encourage young researchers in the field of MS by promoting learning and training and exchange programs. The reason this question came up is because ECTRIMS 2017, going on right now, just getting ready to wrap up in Paris. It was held in Paris this year. Next year, it will be, for 2018, held in Germany. So this is a very, very important event in the world of MS every year. And we hear tons of new research reported and at Ekrems each year. And we hear in changes to protocols, treatment protocols. So that can be very important for the MS patient. So lots of good information coming out of Ekrems each year. You'll see the hashtags used on social media to get all of this information trending. So that's why we've been flooded with that great information coming out of the Congress. So if you couldn't get a neurology appointment with an MS specialist this week, that's probably why they're all over in Paris. No, just kidding. They're not all there, but a great deal. They had a record turnout this year at Ekrem. So that's why everyone is talking about that. We're actually going to have an Ekrem's wrap-up show coming up on MS&Me interviews for this weekend. So that will be on this week's show. You will hear an overview of some of the more impactful research and protocol changes and all that coming out of Ekrems that will impact you greatly in your MS journey. So we'll talk about all that, explain it from a patient's point of view. I know sometimes the clinic speak and the research speak is a little difficult to read those reports that are coming out. So we'll try to review those in a way that are a little bit more user-friendly for patients living with MS. So definitely look forward to that. It's MS&Me interviews this weekend. So definitely catch that. And it will be, of course, saved in our archives for you on demand as well. So that can be an important resource, learning all the latest and greatest that are coming out of Ekrems this year. Okay, let's see if we have anything else coming over for hashtag Ask MS&Me. Okay, this one is coming out of our ladies only group off of Facebook. It says, how common is it to suffer from other autoimmune diseases in addition to our MS? It can be quite common. I believe personally that it is because the root of our multiple sclerosis is, of course, the family of mutated genes that is responsible for the autoimmune diseases. And it's like over 125, well over 125 now, identified gene mutations in that family of genes that's responsible for MS, lupus, rheumatoid arthritis, a bunch of autoimmune diseases in that family. So I think that, of course, when we get the environmental trigger that must actually start that disease process, more than one can be triggered. Just one of the autoimmune diseases can be triggered. So there, you might have multiple triggers throughout your life. You might develop lupus at one point of your life and have multiple sclerosis triggered at another. Of course, when you have multiple autoimmune diseases, since many of them have similar symptoms, it can be very difficult living with multiple autoimmune diseases because the disease symptoms overlap and it's hard to tell what's being caused by which disorder. It can be quite confusing. I know myself, that sometimes the pain from my MS or swelling from this or that, or it's just hard, the fatigue, you just don't know which of your autoimmune diseases is actually causing the symptoms sometimes. You've got to get really, really in tune with your body and well versed with the symptoms to even be able to tell the difference and know the cause. Sometimes you just have to let your doctor really identify what's going on in the disease processes sometimes. So it can be quite confusing, especially when they all, don't have definitive tests necessarily, and they do, like I say, have, they can mimic each other. So it can be pretty difficult living with all of those multiple autoimmune diseases. Myself, I live with a whole list. Lupus, MS, Sjogren's, EDS, fibromyalgia, and it's just the list goes on and on and on and on. So it can be quite long and hard when you're living with all of those like Hashimoto's and all of them that all cause the fatigue, and mixed connective tissue disorder and all these things that can cause such similar symptoms and pain and stiffness and spasms and swelling and what have you. So definitely just keep really connected with your care team and definitely become your own advocate. Learn as much as you can about each individual disorder and know that just because we have more than one autoimmune disease does not mean we cannot have a full life, does not mean that we're going to live with extreme disability level, in knowing our bodies and knowing the disease process themselves and how to combat the effects. It can give us a greater quality of life. So hearing you have more than one is not the end of the world, and we can live a very productive life. So definitely keep that in mind, because I know that can be scary when you hear that you have more than one autoimmune disease. Okay, this one comes in from our Facebook Info Hub. It says, what is this EDSS I keep seeing? What does it measure? Okay, EDSS is the Expanded Disability Status Scale. So, Expanded Disability Status Scale is a method of quantifying disability in MS and monitoring your changes in the level of disability over time. It's widely used in clinical trials and in the assessment of people with MS. The scale was developed by a neurologist called John Kurtze in 1983 as an advance from his previous 10-step disability scale, the DSS. The EDSS scale ranges from 0 to 10 in 0.5 unit increments that represents higher level of disability. So 1 being lower and 10, of course, being the highest. Scoring is based on an examination by a neurologist, although in many places a trained nurse practitioner will also do the assessment. EDSS steps 1 to 4.5 refer to people with MS who are able to walk without any aid and is based on measures of impairment in 8 functional systems, the FS. So pyramidal, your weakness or difficulty moving your limbs, cerebral ataxia, loss of coordination or tremor, brainstem, problems with your speech and swallowing, nystagmus, sensory, your numbness or loss of sensations, bowel bladder function, visual function, cerebral or mental functions, and then other functions. So each functional system gets that score. For the FSS on this scale of a scale of 0, which is no disability, to 5 or 6, which is more severe disability. So the EDSS steps 5 to 9.5 are defined by the impairment to walking. So that scale is sometimes criticized for its reliance on that walking as the main measure, because those of us who have the more severe disability know there's a whole lot more to it, many nuances to what make up how truly disabled we are. It has a lot more to do with than just whether we're able to walk. So although the scale takes account of the disability association with the advanced MS, and most people never reach the upper scores by large part. A large study that looked at people with MS at a clinic in Ontario prior to the development of the expanded version found that 51% of people had a DSS score of 5 or lower. So 88% had a score of 7 or lower. So by and large part, even with the expanded, most people never reach those upper levels, level 10 being death from multiple sclerosis. So that is very rare. So 1, if you score a 1 on the EDSS, it means no disability, minimal signs, and a 1 FS score. 1.5 is no disability, minimal signs, and more than 1. 2.0, minimal disability in 1 FS. 2.5, mild disability. 3 is moderate in one of those FS regions. 3.5 is moderate disability in 1 FS, and then, of course, more in your actual walking and all that. So it just goes up like that. And when you get up to, say, the 6 and 6.5, it's how many walking aids you need and your timed walking test. When you get to 7, it's unable to walk beyond like approximately 5 meters, even with an aid, so you get restricted. 8.0 is restricted to bed or wheelchair, pushed in a chair. 8.5 is restricted to bed most of the day, pretty much are losing effective use of your arms and are under 24-hour care. So 9, you're just completely bedbound, unable to communicate and eat. But like we said, even though these go all the way up to account for all ranges of the effects of multiple sclerosis, those higher numbers are very rare. So you won't see patients that often affected to that great degree of disability in multiple sclerosis, especially with the new treatments. More and more patients with multiple sclerosis are living longer lifespans. That huge 60-year study that came out not long ago actually showed that dramatically. When they started that study, patients with multiple sclerosis were living an average of 14 to 16 years less than the average person without multiple sclerosis. And recent numbers showed that we're only living 5 to 7 years less than people without multiple sclerosis. So I'm sure the newer treatments will even have a greater impact on those numbers. So it's really exciting times, and we have more treatment options. We saw, of course, Ocrevus, and it actually will treat PPMS. So really, really exciting times. We're hoping stem cells will play a greater role. Remyelination therapies are coming online. So this is going to be exciting, like say 5 or 6 years coming up here, with more and more therapies coming online and us living more and more toward the normal lifespans and getting those EDSS scores lower and lower, as we realize how exercise and diet also play a role in our level of function and how we can help control many of our symptoms. So it's really wonderful times for the world of new treatment and opportunity out there to help control our multiple sclerosis. Not wonderful times for us living with this very complex and very sometimes not very nice disease on us. However, it can be very difficult living with multiple sclerosis, but we do have more choices as far as treatment, natural treatments, and many places are making medical marijuana available, and we have stem cell therapies available in different parts of the globe, and more of these wonderful new treatments that attack T cells and B cells, and just, a lot of new therapies coming out, as we saw with Ekrems. So definitely keep up on the latest and speak to your doctor if you have any questions about how your current treatment path is serving you in your personal walk with MS, because there are more options out there for you now. So definitely speak to them. MRIs are becoming more accepted as monitoring therapies around the world, not just used for diagnosis and adverse events. So that's another thing that was discussed at Ekrems as well. So definitely changes to protocol, so you want to speak to your doctor. But join us again next week for another Ask MS&Me. You can submit your questions on social media using the hashtag or contact us through our website, www.msmemedia.com. Tune in again next week.